What's going on, audit and fraud friends and family? I've got a question for you. Now that everything is going digital, including going to the doctor, how do you know that your doctor has actually diagnosed you with the right thing when they only see you online? Have any of you ever been to a teledoc? All right, that's my question for the day. And that's what we're going to talk about: telehealth and fraud on today's episode of the Friday Fraudster. Are you ready? Let's go.
Welcome to the Friday Fraudster podcast. Join them as they discuss sad, funny, and sometimes disturbing fraud stories. Be sure to catch past episodes on your favorite podcasting platform or go to www.fridayfraudster.com.
All right, you heard the question that I asked. How many of you all have ever been to one of those teledocs? I tell you what, I did it recently, and it's quite amazing. You schedule an appointment, and shortly before the appointment, you get either an email or a text message to join a virtual call. And boy, during that virtual call, the doctor asks you what's wrong. They try to figure out what's happening with you. Now, here's the question that I have for anyone who's done it. What if you're complaining that you have like ear, nose, or throat issues? Like, what if you're having some sort of an issue where normally the doctor would just take something and look in your ear or look up your nose or tell you to stick your tongue out and say, ah? How do they do that on a telehealth basis? Has anybody ever had that experience? Because I'm real curious to know what that experience is like. So if you've had that experience, let me know. By the way, you probably noticed that there's somebody missing today. It's just me today. So all you have is good old me. So I'm going to talk to you all a lot because I'm trying to figure out how this whole telehealth thing actually works. Now, Stephanie's here from Idaho, and she says that it's 100 degrees in Idaho. 100 degrees, to which I said, you guys must really be going crazy right about now. So now Carol is here. Carol says, happy Friday. Happy Friday, Carol. Oh, wait a minute. I got a LinkedIn user saying happy Friday. I'm so sorry. I don't know who you are because I don't have my cheat window open right now. Let me open this up and see if I can figure out who this is. No, I can't figure out who this is. Karina is here. Hello, Karina. Now, I think this is Stephanie saying one of my neighbors does telehealth video visits as a nurse practitioner. There are only certain things they take visits for, right? So that's what I was wondering. So recently I did one of those telehealth visits, but it was more like a follow-up. I was having a little congestion. I think maybe I had come up with a cold because I had just been on an airplane, and you know how that gets. You're in a compact area with other people, and you're probably bound to catch something. And so I had gone to the doctor, and they said, well, we don't see anything wrong. But I still felt a little stuffy a few days later. So I said, well, let me follow up. And so the doc was just like, hey, I'm going to prescribe these antibiotics, but if you feel better in a few days, don't take them. So I felt better in a few days. So it was probably just a little cold or something, but she couldn't check my blood pressure or my heart rate or anything like that. So yeah, I'm wondering how that works. So thank you, Stephanie. One of your neighbors is a nurse practitioner, and there are only certain things that they can take visits for. So here's what I'm wondering then. Do you think they can diagnose you with certain things online? Are there certain things that they just simply can't diagnose you for? Because I'm wondering, like, obviously you can't do things like take a drug test or a pregnancy test or any other kind of test online. So what do you guys think are some things that they can't test you for? online from a telehealth standpoint? I just named a few. What are some things you think maybe they can't test you for online? Like I said, I just named a few, but I'm thinking there've got to be a few other things that they simply cannot test you for through telehealth. Now, Marsha is still Marsha. Have you ever used a teledoc? You know, where they look at you and ask you some questions and figure out what's wrong with you via Zoom. Have you ever used some sort of teledoc? I was just telling everybody, Marsha, about how I did it recently, and it was no frills. I mean, it was kind of like a follow up, and so they came to the conclusion that I probably had like a cold or something that was lingering. It wasn't corona, so you know, but yeah, telehealth is becoming a thing. You know what? I'm with you, Karina. I imagine that eye tests, vision tests would be problematic doing it online. You could also cheat too if that was online, right? They tell you to place one hand over one eye and you're looking at this screen. How do they know that you're the right amount of feet back, from doing the telehealth? I imagine they can't check your tonsils through telehealth either. Which leads me to my next question. How do you know that those telehealth visits are actually legit? They're doing a lot more of them nowadays. So, how do you know that those telehealth visits are actually legit? Is there a way to tell? Now, Stephanie told us just a few minutes ago there's certain things you can't do via a televisit, which makes sense because these are things that you obviously can't test for in that manner. But for the things that you can test for, how do you know that the test was actually legit? And as an auditor, how would you actually check for that if you're in healthcare? These are things that I'm pondering after having had one telehealth experience. These are things that I'm wondering. Okay, so Stephanie, you've done it, but more so just to discuss lab results and next steps. That makes sense to me, right? Like, why would you have to get in your car and go to the doctor's office if they just want to give you the results and then tell you what your next steps are going to be? Ooh, so Marsha's saying she did it and it was useful because the person she called about was having a heart attack. Oh, goodness. So I guess the teledoc was able to kind of walk you through what some of the signs were and what to do, possibly on your end. Wow, that sounds frightening. Like that sounds just utterly frightening. Now, what's interesting is I see another comment on LinkedIn that hasn't popped up on my screen here, and it's Abraham Garcia. Abraham says, oh, never mind. He just liked the post. Never mind. But yeah, so okay. So now, telehealth, it's a big thing now, and it's heating up. And if you've ever had a visit from a telehealth doctor, were you satisfied? So I'll tell you, in my case, I was extremely satisfied with what I got because there wasn't much to it. However, there are people out there who are looking to game the telehealth system and do things that aren't good, all for the almighty dollar. And that's what we're going to talk about today. You see, the company we're talking about today, they've been accused of defrauding Medicare, Medicaid, and other health insurance providers to the tune of over $100 million in revenue. That's not a small amount of money. They were recently investigated by the Department of Justice, and they've been arrested. So we'll see what happens when they have an arraignment. But before I finish with the rest of the story, $100 million, doesn't that sound like a lot of money to you all? Like we've talked about some astronomical numbers in fraud, but that sounds like a lot of money. So, anybody want to guess how they did it? Anybody want to guess how they actually did it through telehealth? Because I can almost guarantee you, if you've not read the story, and no cheating, Karina, she's already read the story. I can guarantee you, if you've not read the story, you will not be able to guess. This thing has so many twists and turns that it sent my head spinning when I read it. So, anybody care to guess how they allegedly defrauded the government and healthcare providers of over $100 million in revenue through telehealth? Now, Shree has a guess. Shree's over on YouTube. By the way, if you're not subscribed to my YouTube channel, what are you waiting for? Subscribe. There's the link down there scrolling across the bottom. Shree said billings for things that didn't happen or overcharging. Well, you'll just have to wait and see if you're right. I will say partially right. Now, Stephanie says logging visits that never happened. I wish I could say that that's what they did. I think a lot of their visits actually did happen. That's even scarier, right? Ooh, now Marsha says double up on the bills with patience. That was a part of it. That was a huge part of it. Now this was a multifaceted scheme. Now my next question I want to ask you guys, what do you think they were selling, quote unquote? What services do you think that they were selling to amass an alleged over $100 million in revenue, defrauding insurance companies in telehealth? Allegedly, right? Everything is alleged up until the time they are actually tried and convicted. Okay. So let me just give you a little hint. They actually ran a subscription service through their website. And so what they would do is they would get people to subscribe to their website. And for that subscription, they would receive pills on a regular basis. So that's my first hint. That's my first clue. Can you imagine? We have subscription services nowadays for everything. You can get your food through a subscription service. You can even get clothes through a subscription service. I remember at one point in time, I was subscribed to this service that would send me things in the mail, and you could either keep them or send them back. And so they would send me bow ties and pocket squares, and most of the stuff I kept. I mean, let's just be real. But can you imagine now having health care through a subscription service? Now, I'm not going to tell you exactly what kind of healthcare just yet, because some of you are still guessing. Shree said they were selling weed. Shree, they were not selling weed through the mail. I would say that what they were doing was actually worse than weed. Stephanie says mental health. Related, fairly close, fairly close, fairly close. Oh, somebody says, was it the little blue pill? It was not the little blue pill, but you know that's I'm told that there's some subscription services that do that nowadays. But it wasn't the little blue pill. And this, is that even covered by insurance though? I don't think that's covered by health insurance. It might, I don't know, but I don't think that's covered by health insurance. I see you back there. I see you. No worries, you're all good. Okay, now Roberto Hernandez, you're only showing his LinkedIn user, but I've got my cheat sheet here on the side. Roberto says, I think we should have audits on medicine they give to patients that exceed what they require to take. Aha, now you're on to something. For example, you take one pill a day for 90 days and you visit the doctor. Specifically with Medicare participants, the clinic gives you more medicine than was needed. Yep. Now you're on to something, Roberto. Definitely onto something. Now, Marsha's saying, yeah, the blue pill is for prostate cancer. Wait, Marsha, are we, wait, the same blue pill that does the other thing? Which blue pill are we talking about here now? Okay, okay. I'm not alone today. Christine decided to show. You've colored your hair. Look at you.
I cut it.
You cut it and colored it, didn't you?
Well, I always color it because I'm gray. Sorry I'm late.
No big deal. I was worried. I was wondering if everything was okay. I was gonna get off and then message you and be like, "Are you okay?" But
No, I was fine. I mean, like we talk to everybody. I have a job that I actually have to do. So it's just been a really cool Friday today. So
Shree said you're on time anyway, so it's okay. So now,
I'm doing Central Standard Time. What are you talking about?
right. So you kind of heard what I was talking about. I was asking people if they had ever done telehealth because I did it a few months ago, and it was interesting. And so I've given them small hints about today. I just said that this company had a subscription service where you could get certain things, and I'm having people guess what kind of services they were actually providing, and what kind of services they were actually providing. And now Marsha is educating me because she said the little blue pill is covered by insurance. I didn't think it was. I didn't know if it was or not. She said it's covered for prostate cancer, but not ED.
Which I could see
Had
that.
no idea. Yeah, had no idea. Okay, so the company that we're talking about today, you guys, they actually had a subscription service, and one of the major things that they were selling was Adderall. The reason that they got in trouble, now that's one of the major things. The reason that they got in trouble is because the federal government is alleging that they had some unscrupulous practices. For example, they had a network of providers. And what you would do is they had a lot of advertisements on social media platforms. Hey, if you have these problems, come sign up for our subscription service. So the first thing that the government is alleging is that they had deceptive practices on social media. So whether that's making promises that they couldn't fulfill or whatever, but there were some deceptive practices. Now, once they got you in, they had a network of providers. Now, some of the providers are now saying that they felt uncomfortable because the company had a rule of saying you can only see patients for 30 minutes. And these providers are saying, listen, it takes more than 30 minutes for us to determine if someone has ADHD, which is one of the primary things that Adderall is used for. They also discouraged follow-up visits. And what I thought was interesting in some of the correspondence I read from the company is they said, well, they could see them on a follow-up basis if they wanted to, but what they didn't say was they didn't pay their providers for those follow-up visits. So that seems like it's discouraging if you ask me. What do you think, Christine?
I do. I like one of the things and I don't know if you said this already. A lot of this happened during the COVID-19 pandemic. Right? So
yeah.
It makes me kind of sit here and wonder. I mean, we already knew that it was hard to at that point getting into doctor's offices. It was almost like only if you need to come. So I did notice that somebody said you need a new prescription at least every 90 days. Is it something that this was an easy way for them to skirt around having to go in because of all the changes that happened with COVID, and this allowed this to happen?
Well, so very good question. And here's one thing that I was thinking about. Oftentimes when you diagnose someone with something, you have to have a certain number of hours that you've spent with them. The actual codes that you use for medical billing and coding say you have to spend X amount of time in order to bill for this specific code. So what I'm wondering is, did they even lie about that when they were billing out? To your point, were the rules bent a little bit during COVID for that? Because how are they able to do a diagnosis? Now, the other thing is, they may have been prescribing it at a cheaper rate for people who were already diagnosed. So now that's a different
Yep.
thing altogether, right? So how were they able to do that? Because let's dig into some more of the allegations. They alleged that what someone said earlier, they made the prescriptions for longer than the patients needed. Now, they did this in a very interesting way. Most websites nowadays have a button that you can click to
Mhm.
subscribe and save, right? Get things sent to you periodically. Well,
Yep.
apparently they set that button on their website to automatically be on by default. And so people were getting pills even when they did not need them. Now, the other thing I read though was that they were charging the patients for the subscription service and also charging the insurance company. Now that was they were alluding to the fact that they may have been double dipping. I didn't see that directly stated, but that's what it alluded to in the documents that I read. What do you think about that one, Christine?
We've seen it before on stories that we've talked
Yeah.
about the healthcare industry. This is kind of almost making me think it got back to your point that you were talking about, like, oh, I only need to see you for 5 minutes and we'll give you an ADH medication, right? This is the
Yep.
opioid crisis all over again.
Yep.
Come
And
in, let me see you for
what's
10
even
minutes.
what's even scarier about it though is that currently in the US, we have a shortage on ADHD medications. So this
Yeah.
exacerbates the problem.
Mm-hmm.
Now, you're going to be shocked right now what I'm about to say next, because
Okay.
the Department of Justice is alleging that the company arranged for the prescription of over 40 million pills. 40 million?
Well, okay. So, I mean, how long was it over? How many years did
Oh,
they
now
do it?
that part I'm not 100% clear on. Let me see if I can find it real quick. But yeah, how long did last? Okay.
It had to be what, 2, 3 years?
Yeah, I think so because it wasn't explicitly mentioned in many of the docs that I have, but it did say that it started around the pandemic. So let's say if it started in 2020, that's 3 to 4 years.
You're looking at over 1 million pills a month. That's a
Wow.
lot. Divided by,
Now,
let's
the
just,
other thing that happened was the Wall Street Journal did an article on this company, or well, of some of the patients who received drugs from this company, because there were a lot of deaths that had happened. And
mm-hmm.
the company, from what I saw, kind of explained it away. Um, but there were several, and several meaning more than three, right? There were several deaths that occurred from people who had received drugs from this organization.
Yeah. Now it's making me, I'm gonna quick Google something. I'm not using my computer to search for this, but
Yeah, Karina says the FDA posted that shortage in 2022. Yeah. So what's happening too is, because there's a shortage, what's going to happen? The cost of those drugs are going to go up. Now, we're going to going to ramp up manufacturing, which means we might actually, and I don't know where we're sourcing it from now, but there are a lot of drugs that are now sourced from overseas, China and some other countries. So we'll probably ramp up our activity, our buying activity from these other countries of these drugs, because obviously there is a shortage. There are people who really need it, but there are also, as we can see here, a lot of people who don't really need it. Either they're using it and becoming ill and or dying, or they're reselling it. Because what people were doing with a lot of Adderall pills is they chop them up and they snort them. And so you get this
And the
high from them.
average street price for Adderall is anywhere from $3 to $15 a pill.
There you go. There you go.
And isn't
3
that,
to
I'll have to Google, but isn't that a pretty big drug to be used on college campuses?
Yes. Yes, it is.
Yep, the most common abused prescription stimulant among college students is Adderall.
That is insane. And it makes you wonder, okay, so since that is one of the most used drugs on college campuses, is it because it is so readily available, or are people going to seek that out? And here's where I'm going with that question. Now, obviously, people smoke marijuana on college campuses, but
Mm-hmm.
before we had prescription marijuana, you had to go and seek it out. But with Adderall and some of these other drugs that are prescribed, there are a lot of kids who have them and would be willing to sell them to pay for college or whatever. So, chicken or the egg, cart or the horse, which came first? Um, the need or want, the desire for it, or the fact that it was available and people realized that they could take it in other forms.
Right. I mean, I don't know. I mean, I can
Uh,
understand, especially for college students, when you sit there and you've got to get your GPA up, you're spending a lot of money. Soccer moms too. But yeah, I mean, there's gonna be those people that are like, I need this, and they'll go that route. They'll pay that monthly amount. I'm sure it wasn't the people using telehealth that were the ones that complained about it.
Now Shri and Karina, Shri is saying it helps you stay focused, and Karina's saying it was commonly used to, quote unquote, help them study for exams. And she's saying in her college days, students found ways to obtain Adderall without a prescription.
Yeah.
Wow. Now, Marsha is saying that drug is a prior authorization drug and has to go through a team of medical personnel within the insurance carrier. It does, which is what makes what this company was allegedly doing even worse. They were finding people and then having a network of physicians to diagnose them and or to continue a previous diagnosis by allowing them to get the prescribed drug. And there are reports of the medical providers saying that they felt pressured to see them in under 30 minutes, which is not proper time, which is not enough time to actually do an effective diagnosis. So now one of the questions I have is, if you know that,
Mm-hmm.
how are they actually billing it with the insurance company? Because if they were billing it as a 1 hour visit, but only making the providers do 30 minutes, now you have a totally different level of insurance fraud that has occurred.
Did they
And so
even
I
do the
wasn't,
30 minutes?
that's another question. Did they even do the 30 minutes?
I mean, in all honesty, if you sat here and told me that 50% of the people that were in their records weren't real people and they were just billing, that wouldn't surprise me.
Yeah. Well, because here's what's really disturbing. Every article I read made it seem like the actual physicians were victims because they talked about how they were afraid and how they couldn't do longer visits because the company would not let them. Well, if you knew that it took longer to diagnose someone, don't you have an oath to do no harm as a physician?
Right.
Because people
Well, and I'm
died
guessing they're going
because
to
of
lose
this.
their license.
And that's the other place I was going with it. Like, what? Yeah, what's the fallout from this? We have the company who had over $100 million in revenue and possibly dispensed over 40 million prescriptions for Adderall and other such drugs. But how far does it go?
Well, and it could be, are they going to wait and see what comes from the DOJ on this before they do that? I mean, is it easier for them just to sit here and go, we'll just wait for this to see whether they get charged with it? And if they do, then we can just revoke it. I don't know how long that process takes to get a medical license.
That's a good question because some people might say you should just do something now, and other people would say wait. I mean, obviously, you don't want to convict someone without a proper trial. But I was also reading, though, that during the height of this, after the Wall Street Journal reported on it, and after a few other things happened, there were a few big box retailers that stopped prescribing medications from this particular provider. Walmart and I think CVS were mentioned by name as being two retailers who stopped filling prescriptions, stop filling prescriptions from that particular provider, that particular carrier.
Ooh, but here's the thing. Are they the CEO and founder? They're not doctors.
Right. Yeah.
But you're anybody that would be working. Well, yeah. Well, I guess,
They
do
were
we even
simply
know who our
intermediaries.
doctors are working through telehealth?
Well, and that's the thing. They were, if I'm reading it correctly, they were intermediaries. And so
Okay.
you didn't really need to be a doctor to start a telehealth company as long as you were able to find the patients, which they did through what we know now were allegedly um, um, false advertisements on social media. If you're able to find patients and then connect them with doctors. Because if you look at it, during that time period, most clinics were closed and doctors needed to find a way to continue serving patients and making revenue. Notice I put the serving patients first, right? Serving patients and making revenue. So they were just the middleman, which I don't see anything wrong with that. We live in a
No.
capitalistic society, and that's capitalism through and through, right? So, but the checks and balances failed somewhere. Yeah, now Marsha
Yeah.
really hit it too. They aren't doctors and nurses, but a group of call center agents to a certain extent, but they were supposed to be connecting. Well, actually, they were connecting patients with doctors. But here's the thing. Someone who's not a doctor should not have the authority to tell a doctor how long it takes to do a diagnosis on a patient.
True. No, 100%. I agree with that. But then so then I kind of look at it from this perspective. You go on to Teledoc, right? And I've done it before for an ear infection. Okay. And I'm guessing that doctor gets paid for so many Teledoc visits, right? But is
Yeah.
there any control in there that sits there and says, all right, so based on capacity, let's say based on capacity, we are going to prevent you from seeing any more than 10 patients in a day? They're not going to do that. So is there
Yeah.
a monetary benefit as well if you've got this third party vendor going, we would like you to keep the appointments around 20, 30 minutes, but if you can push them out more, that's completely fine. Like, do these doctors have quotas to push them through more and get paid a little bit more? I mean, I think there's a lot on the back end to look at.
Well, that's the thing because a part of my guess is they didn't have exclusive arrangements with this company. However, if this company is sending you a majority of your patients, you're going to be loyal to that company, which is the point that you're bringing up. So they probably didn't have quotas, quote unquote, imposed by the company. The company just said, okay, we would suggest and we would like for you not to make these visits last longer than 30 minutes. And my guess also, though, is the company provided the platform, and so the company could monitor it. But to your direct question, I think you would only find that on the back end using data analytics. Hey, here's
Mhm.
Dr. A, here's how many patients they saw per whatever, per hour, per day, and then that would come up.
Yeah. Well, it does say they charged more than 5,400 defendants who collectively have billed federal healthcare programs, and they're currently taking steps to hold providers accountable for the involvement. So I'm just wondering if it's that many years, that many doctors that they're trying to get all their ducks in a row before they start going after the doctors.
Yeah, yeah. Now, Sri says on a college campus, everyone knows who you can get what you need. And Marsha talks about better health. You see better health advertised everywhere on YouTube, right? And granted, this company is not better health, but they were accused of having, well, not the best marketing practices on social media.
Mm-hmm.
Yeah, that's a good question, Karina. Will these clinicians who followed these orders to prescribe Adderall lose their license? That's kind of what we're wondering. Because I imagine at some point, even you as a physician would have to look through the patients you've serviced in a given time period and say, wow, this is a lot of patients.
Makes me
It's a lot of
wonder how many
patients.
doctors. And going
Here's a
off of like, go ahead.
Oh, no, no, no. Go ahead. Go ahead.
I was going to say, going off of Marsha's comment, um, benefiting from the sale of drugs or whatever, like it makes me sit here and think you're on a college campus. It takes one kid to find this online thing, and somebody going, oh, how did you get Adderall? Oh, it's just this website. I pay this monthly thing. And then that information probably spreads like wildfire.
Yep. So here's the big question that I have. Who is or who should be responsible for monitoring this activity? And here's where I'm going with this. When you think about this company, it wasn't a publicly traded company. So they didn't have an internal auditing department, right?
Mm-hmm.
So now, with that said, who should be responsible? Because here's kind of the way it works. Because these are controlled substances, the physician has a number. They have a physician number that gives them the authority to prescribe drugs. Now, that number is also used by the Drug Enforcement Agency, the DEA, because you have to have that number in order to prescribe drugs in order to comply with the DEA. So now, is it the DEA's responsibility, or do they currently do something like that to say, okay, look, our doctor with number ABC has prescribed X number of drugs?
Mm-hmm.
Because to a certain extent, though, it makes it difficult because when you're in a hospital setting, the hospital uses typically the pharmacist number in order to
Mm-hmm.
order drugs from the DEA. And so even now it's hard to track it because it's not a one for one. It's, hey, this hospital ordered X number of drugs and then they went out under one number. So who would be responsible for tracking this, but how would they track it?
So I think in hospitals, they have what are called medicine dispensing machines. So you actually have to like type in, and I forgot what they're called. I've seen it there's a TV show or a show on Max that I watch, Nurse Jackie.
Nurse
Good show.
Jackie,
Check it
yes.
out. Yes.
Very
So
good show.
yeah, so they ended up getting that medicine dispensing. So you had to put in your code and everything else. So I think that's how the hospital probably controls between what's coming in, coming out, who it's being billed for, and they monitor it that way. I would almost sit here and think DEA, yes, I think they should monitor it. I think they would be able to monitor it using some AI data analytics where it could sit there and take a look at the volume of prescriptions, type of prescriptions, but be able to also look at it over a time historically over time. Because I think if they would have sat here and looked at this, like you mentioned, 40 million pills, right? Which we were like, okay, if it was for 3 years, that'd be just over 1 million pills a month. Well, they didn't start, prescribing out 1 million pills a month starting from day one. It would have had to have ramped up. And I would think that somehow would give a red flag for what they're prescribing for just Adderall.
You think, but here's the other thing. So now, what you were talking about the drug dispensing cabinets, right?
Mm-hmm.
Most hospitals have them, and there are two different brands that are the most popular out there. One is called Pyxis, the other one is called Omnicell. And you do have to do some sort of code. Sometimes it's biometric, sometimes it's a 1, 2, 3, depending on how the hospital wants to set it up. You do have to enter in whenever you disperse something. But here's the thing where it gets tricky, because before it even gets in that machine, it goes to your central pharmacy. And so you have a central pharmacy in your hospital where things can become misplaced. And then you also have techs, pharmacy techs, who go out and load the machines before it even gets to the machines. So there are multiple levels and layers to where these drugs could just disappear.
So, all right, this is kind of along the same lines, but it almost, because being in banking, we've talked about marijuana banking a lot and everything else. So understanding how like certain states like Colorado and Michigan and stuff have legalized marijuana, right? I almost feel like the DEA has better controls over marijuana purchases that don't require a medical card than they do over morphine, opioids, Adderall. Like, that's just crazy to me. Because, like, I haven't heard.
I would say that is true.
Yeah. So, like, if
I
you
would say
work
that
at
is
a
true. And I'll tell you,
center and you drop marijuana on the floor, you can't just throw it away. Like, you have to package it. You have to, like, weigh it. You have to put a sticker on it. You have to scan it. You have to log it. And then it has to be destroyed a certain way.
yeah. Well, so for those of you who are unaware of how this works and what Christine is talking about, let's dive into that for just one moment. So now with your controlled substances, the DEA, the Drug Enforcement Agency, they control that. Well, they control your ability to be able to order it and buy it from companies, essentially. So they give doctors a number, and that number gives them the authority or the right to order it from drug companies. Once that gets into your hospital or your physician clinic, in theory, you could do whatever it is that you want to it. It's up to each individual hospital to put good controls in place. Now, when it comes to marijuana, though, there's this concept called seed to sale, meaning you have to track marijuana from the time it is a seed until the time you sell it. And what Christine was saying, you have to have a barcode or a way of tracking the seed that gets planted in the ground, the plant as it is sprouting, the actual leaves, as we say, as they're being harvested, all the way until they reach the retail location. And you still have to track them in the retail location where they are being sold, in the local dispensary. So you have to track marijuana from the time it is a seed until the time it is sold. The same is not true for these other drugs, controlled substances. So yeah.
Yeah. Yeah.
That is a very good point. Now, Marcia is saying doctors are audited along with pharmacies for narcotics and other controlled substances regularly. I don't know if it's as regular as you think it is. So I was a chief auditor in healthcare, and we had pharmacies, and when you say audit, that term can be loose because my team only went in on a few occasions. Now, granted, your pharmacy team is going to do an inventory, right? But
Mhm.
obviously, with any inventory systems, if you are the one doing your own inventory, you can find a way to circumvent controls. So maybe not as
That is
often or as
a
thorough as
great
you think.
No, that is a great way of putting it. So when you have these external auditors, right? So I'll kind of put this into perspective in the banking industry because I geek out on that stuff. So you've got these external auditors that come in. What do they look at? They look at your policies, your procedures, your controls over the medication, right? Do they really do any internal controls testing around it? And I don't know because I've never audited healthcare. But to me, it would be no different than like the FDIC, NCUA, your state examiners going into a financial institution. They look at your policies, your procedures, and your internal controls over cash, but they don't do a cash audit. They don't count your cash when you're there. So
Yeah.
you could have monetary losses at one of your branches if you're not testing that internally. An audit like that won't find it.
Yeah, it's pretty much the same with your healthcare regulators. When they come in, there are certain things that they do look at, but they're not coming down into your pharmacy and actually looking at your controls over your controlled substances or doing an inventory count or anything like that. It is heavily skewed towards your policies, your procedures, your operations, your operating environment. So, if you say we have a policy to audit inventory every 30 days and that's your policy, then great. They may ask for some evidence to show that you've done it, but as far as doing detailed observations and understanding your processes, it can be done 100 different ways. They aren't digging in to look at your particular process to see if you have Omnicell versus a Pixis and how that actually works. So, yeah,
Did it say how they got found or how they came across this?
that's what I was wondering, and I just could not find it. Apparently the Wall Street Journal has been talking about it for a while. So okay, so there were some clues that something was wrong. There were some deaths that had occurred, and those people had gotten pills directly from this company. The Wall Street Journal then investigated twice, I think. I know at least once, but I think it was twice that they had feature stories, and then it started to unravel from there. So my guess is the Wall Street Journal kind of blew the lid on some of it, and then the Department of Justice got wind of it and said, "Wait a minute, this isn't right," and then started doing their thing.
Yeah.
Marsha's saying that's why there was a great debate on Ozempic. Yeah, yeah, yeah. Karina says this company has an autofill option too, and then you can get a routine supply without follow up. Yeah, yeah. And whether the patients wanted it or not with this company, they were putting on the autofill option. So yeah.
Well, and I would think if there was an individual that needed ADH medication, they would need it refilled. Like it's a
Oh, for sure.
medication that it's a daily medication that's taken, right?
Yeah,
So
yeah,
I would think that they would need it. But yeah, then again, get through that college course and your next bottle ships. Um, yeah.
yeah. So this goes another step further. Then were they misdiagnosing some people for the sake of profits? I mean, I think we probably
Oh,
can speculate the answer to that, right?
well,
But yeah,
I'm guessing not everybody that was on it needed it, and I'm guessing there was probably at least one or two people, at least, that were getting it because they wanted it. They know they didn't need it. And that's
yeah.
something that those healthcare providers should be able to decipher. Because I don't think a 30-minute meeting would tell somebody if they need to be on ADHD medication.
No.
I mean, I would think that there would be quite a few follow-ups before that.
Let's see here. Let's see what the trusty. internet tells us the process of diagnosing ADHD can vary from person to person. Typically, it involves gathering information from different sources, such as the individual's behavior, medical history, and any related assessment. In general, the diagnostic process can take several weeks to months to complete. It is important for healthcare providers to conduct a thorough evaluation to accurately diagnose ADHD.
Yeah. Okay. So the CDC did say the potential closure of Doan could impact 30,000 to 50,000 patients nationwide.
So now the big question is, how many of them are actual patients who had a need for the particular drug that they were prescribed?
Yeah, I don't
Because I
know.
imagine, even though it affects 30,000 patients, I mean, you can find another doctor. Your medical, if you are legitimately diagnosed, your medical records should go with you to another doctor, and you can continue your prescription. I would imagine.
Did you go to their website?
I did not. I just I thought it was down.
No, it's
Wait, what's the
not.
website?
www.donefirst, DONEFIRST.com. Their header goes done, and then ADHD, pricing, facts,
Oh wow.
specialized ADHD care made for you.
Well, yeah, there it is right there. Done. And by the way, folks, the name of the company was Done. So Done. ADHD. ADHD guide, treatment, testing, symptoms, diagnosis, medication, find a doctor, take the assessment. Oh boy. Wait a minute now. You mean
Yep.
there's an internet assessment that can tell me if I have ADHD? Absolutely not. I don't believe it. So I'm guessing that after you answer these questions, they ask for your email address. And now that they have your email address, they can continue to send you messages, which is part of the allegation that they were using, very interesting marketing tactics.
Well, and they've got a Dunn brand ambassador who was a former NFL player.
Oh boy. Let's see here.
I don't think he's playing anymore.
Oh, okay. So here's a statement too. Dunn Global strongly disagrees with the criminal charges filed last week against our founder, Ruthia He, and Dr. David Brody. So one was a doctor, which are based on events that principally occurred between February 2020 and January 2023. Since our founding, Dunn Global has worked to make mental health care accessible for tens of thousands of Americans trapped in a spiraling national crisis. Dunn Global will continue to operate and do everything in our power to ensure that tens of thousands of Americans that rely on us do not lose access to their mental health care. At the same time, we will continue to support our clinicians as they exercise independent clinical judgment. There's that separation that they're making sure we know about right there. Practice evidence based medicine and provide best in class health care. Now, here's one thing I will say that is kind of interesting. Um, are they a healthcare collaborator that specializes in ADHD? Because this reads like they're a healthcare provider that helps with mental health. Well, ADHD is simply one type of mental health. Which are you? Um, and that may not make a difference to some people, but to me, the devil is in the details, as they say. Um, Seems like you would have said we specialize in helping people who suffer from ADHD do blah blah blah. But it definitely sounds better if you're a global mental health care provider.
Yeah. Get
Very
medication delivered
interesting.
to your door. They don't even have pharmacy partners listed anymore.
Oh wow. Wow. That's interesting. It's possible that they partnered with some sort of mail order prescription service to get them delivered. Because yeah, the last thing I read was a few large pharmacies stopped doing business with them. So there's a brand ambassador, plays for the New York Giants. 40% of their patients report that their symptoms improved within the first month. That was based on a survey of 1,200 patients. They have a few psychiatrists. Well, I think the bad thing about this, though, is the good are going to suffer with the bad. So for every good doctor that they have, their name might um, might be dragged a little bit through the mud because of a few bad ones. Karina's asking what is their mission statement. Let me see. Ah, here it is. Let's see. Give me just 1 second here, Karina. I might need to make this a little bit bigger so that everybody can see it. There we go. Mission statement done. Always anyone who is challenged by ADHD allows, sorry, like, look, you guys, I can't read today. Done allows anyone who is challenged by ADHD to receive the help they need and live up to their fullest potential. We provide awareness and education for people to learn more, private and accurate medical diagnosis through telehealth, and actionable ways to receive immediate treatment. We believe this holistic approach to the challenge of ADHD demonstrates our commitment to ensure that no one is left behind. Our mission is to empower everyone to reach their fullest potential. We meet that mission by providing a patient first, technology powered platform that keeps costs down and reduces patient wait time. Unchecked and untreated, ADHD can hamper brain development and impede everything from a person's social skill to their productivity in a professional environment. While the condition itself is considered very common, more than 3 million cases now diagnosed annually in the US alone. The treatment opportunities for ADHD are anything but common. Most people suffer in silence. So there you go. They specialize in ADHD.
Oh my gosh, they even have a student discount program.
Oh, wow. Very interesting.
Student program's only $59 a month.
You know, here's the other thing, too. Based on what we just read on their website, they're saying that most of the activity that they're being questioned about happened between 2020 and January of 2023. So that begs the question, were there some bad practices? Were these two individuals, I think they were the founders, were they involved at this point in time? Were they aware of what had happened? Or was it a case of certain things were happening that were bad? They were unaware of it. They found it, fixed it internally, but then didn't say anything else to anyone else.
Yeah.
That's always a possibility, right?
Yeah,
Always a possibility.
and I'm not saying student discounts are bad at all. Not saying that at all. I'm saying it just, when you're pretty much being accused of delving out this medication without any real needs, it kind of almost looks like, oh, you're catering to student needs for the students that don't need it.
It
It
definitely
doesn't
looks
help
that way.
their case.
Yeah. Yeah.
Because
100% looks that way.
did it say what the deaths were, who the deaths were?
Yeah, I read some articles where they talked about a few of the people who had died, and but yeah, I just didn't bring that up in detail. But yeah, there was some mention of some of the deaths that had occurred.
I can't find it. Yeah.
quite interesting. And by the way, since we have you all here, if you've not subscribed to my YouTube channel yet, it is scrolling right there along the bottom. Why don't you go ahead and subscribe? You can catch this podcast as well as the Audit Bites podcast live on YouTube and LinkedIn. On YouTube and LinkedIn. If you're watching on YouTube right now, drop us a comment. I just want to see how many people are actually watching right now. Only a handful, like 2 to 3, from what I can tell, are watching
I'm
right now on YouTube.
sorry I showed up late.
You are all good.
Yeah, well, they had a thing on Forbes Health back
Look
in
at that.
2024.
That other guy showed up on YouTube. But no. All right. So what else did you find?
Nothing.
It's just interesting. This one is going to be interesting as it unfolds because it does seem like it is reminiscent of some of the other what was someone said it earlier, the huge drug where they found the opioid epidemic that occurred. Because I don't know if you remember, there was one town in South Carolina that had so many prescriptions that were filled in that town that it was more than the number of people that was in the town by like double, I think. And so that was one big tip off.
I think it was an opioid documentary.
There was an opioid documentary. Karina says she's watching. She's on LinkedIn, and Marnie is here on LinkedIn.
I think it was the pharmacist. Yeah, after his son's tragic death, a Louisiana pharmacist goes to extremes to expose the rampant corruption behind the opioid addiction crisis. That was a really good documentary.
I think, yeah, I've seen that one too. There was another one too. There were a couple of them. All right, you guys, look, I got a special announcement I want to make though. So listen, give me a couple of weeks and you guys will be able to get CPE credit for watching this podcast. So what you'll do is you'll be with me and Christine and any of our other special guests in a Google Meet room. And then we'll still broadcast live to LinkedIn and all the other platforms. But you guys that are with us, shortly after it's over, you'll go straight to a quiz. You'll take a quiz and you'll get your certificate right afterwards. I've tested it in the background and it looks like it's working, but I got to test it some more. I was going to do it today. And then I was like, nah, you got to test it a little bit more. Anyway, Stephanie's still here. But yeah, it's just pretty interesting and fascinating. So if you've just joined us, today we're talking about a company that essentially was an intermediary and hooked up patients with providers, specifically people who suffered from ADHD, and they got ADHD medication shipped to them. But the federal government is alleging that, well, some of those prescriptions may not have been legitimate, or some of the services provided may not have been legitimate. So far, there's been an indictment. And so these people have been arrested. So at this point, I'm guessing that it's gone to a grand jury, and a grand jury has said that, okay, it looks like enough evidence for you to arrest them. And so now there'll be a court process, possibly, most likely, right? So we'll see.
I mean, this all came about in 2022?
22, 23-ish. Yeah.
We'll see the verdict in 2025?
Probably. I mean, if they've been indicted and if they've been arrested, then it'll probably take a while for it to go to trial, and then the trial will probably last for a little while. Yeah. Well, I think the big thing is who's really guilty here, right? Because it could be that the owners of this company are totally innocent, because they were the intermediary. And it could be that these physician and physician clinics saw an opportunity during the pandemic and took advantage of an opportunity. Or it could be, as the government alleged, that they were using some interesting advertising, but they weren't necessarily guilty of the drug part. Or it could be that all of them were in on it together. I mean, so many different things. Now, Karina has a good point. She said that recently I talked about questioning whether policies are still relevant. Should policies put in place during COVID-19 be revised or revisited regarding prescribing certain meds without in-person visits? Yeah. And if you guys missed that, that was the most recent episode of the Audit Bites podcast where I talked about consistently questioning what we're doing now just to see if it's still relevant. Not saying that it's right or wrong, but asking, is it right or wrong? Is it still relevant? We got to ask the question, right?
In all honesty, you should be looking at your policies at least once a year.
You should be. But you know what? I'll be frank with you. After being in the auditing profession for over 20 years, 30, well, almost 30 years, wow, a long time. At one job, I was actually a part of the policy committee. And I would say that's probably the only place where I saw it done even remotely close to right. But every policy that was deemed to be a significant policy, so we risk ranked the policies. Every policy came back before the committee on an annual basis. I'd never seen anything like it. It was pretty doggone good. But yeah.
Yeah.
Ooh, now Stephanie is saying to Karina, some states have. She said that she had to get a new provider because she moved even after doing telehealth for 2 years. Yeah. So
I mean, I think telehealth is a good thing. Like I said, like I was able to get to see about an ear infection and it took me 10 minutes. And I mean, for them, they're like, all right, let's go ahead and we'll try doing ear infection medication. Like, I'm not going to abuse that. At least I don't know if there's a way of doing it. But, so I don't think we should get rid of it.
Okay. Here's the question that I have for you now, Christine. How did they diagnose you with an ear infection remotely? Because normally they look in your ears and they see that there's a lot of fluid buildup and they say, yeah, you probably got an infection because there's a lot of fluid buildup. How did that work?
Probably because when I called them, like at that point, the pain in my ear had been lasting for about like 2 weeks.
Ooh.
And it was, yeah. So I was like, it's just right. It's like right inside here. And it kind of hurts like coming down here, but I don't have a fever. I don't have anything else. There's no jaw pain. So like, and then they would ask me follow-up questions like, is this hurting? Is this hurting? Have you done this? Have you done this? And they were just like, all right, well, we'll go ahead and prescribe you some ear drops. And if the pain does not get better within a week, then you need to go in and see your family doctor.
Okay.
So it wasn't like I would call them back and then go, all right, let's try this. They were like, okay, at this point, if this doesn't work, then you need to go in and see your regular doctor.
That makes sense. And I guess it also helps too when you have a patient who knows how to communicate. Because I remember one time, even before telehealth, I went into the doctor and I was having some issues and I had written down everything. And the doctor looked at me and she said, I just want to say thank you. And I'm like, for what? She said, for being so thorough in the way that you communicated your symptoms. And I'm like, well, if I want to get better, what? I mean, so I imagine you helped out in that situation too by being able to clearly articulate the symptoms and when they started and what happened and how you were feeling. So, okay. But I was wondering how that worked with something like an ear infection. Because I can't imagine they would ask you to say, like.
Oh, yeah.
Like remote.
Put my face up to the camera. No, but it would be, I mean, I know you guys are talking about costs to go to doctors and stuff. Just a heads up, I did not know this, but now apparently, and I hope maybe it's just who my insurance was through, your annual visits, like, do not talk to them about any questions of things that you might have. Right. Because then they bill you for an extra visit. Like if they
Mhm.
sit there and go, "Oh, is there anything that you're worried about?" And if you're like, "Oh, I've got this like rash on the side of my leg that I've had for like 3 months," I'm not going to make a separate doctor appointment to come into that. They will bill you for that.
Yeah, well, that kind of does make sense based on the way you bill, because you do bill. Yeah, that kind
Well,
of
and
makes
mine
sense.
was mine was just like, okay, because I turned 40. So she's like, anything that you want to talk about? And I'm like, well, nothing really. I don't have anything. And she was just like, well, have you had a blood panel ran? Like you're at that age, you should really start knowing your numbers. And I was
Yeah.
like, okay, this is my annual physical. Got a $300 bill in the mail. And I was like, oh, I probably should have said no.
Wow. Amazing. That is that is
Yeah.
insane.
And part of that bill was that they billed me the extra, I think it was 15 minutes that she was in the office with me. I don't.
Marsha said that's one visit. So are they charging per symptom? So yeah, not really, but the way you actually bill, you can bill for diagnosing people. You can bill for certain treatments, and you just have to know the code. And sometimes the code, so I'll give you an example. Um, let's just say if you come in and you have a surgery, well, you can bill one thing for the surgery, something else for the anesthesia, but the anesthesia gets real tricky because if you have the anesthesia for less than a certain amount of time, you bill one amount, but if the anesthesia happened for more than a certain amount of time, you bill another amount. So you have to track the timing on your anesthesia to know what to bill. So it gets real tricky. Some things you can bill in 15-minute increments, other things 30. It really depends. Man, I spent too long in healthcare. I'm just sitting here listening to myself, and I'm like, I shouldn't know all this. But anyway,
What you
that's
do?
our right. That's our story for today, guys. Christine, anything else you want to say?
No.
All right. So look, guys, thank you for joining us. Subscribe to the YouTube channel. Follow Christine and I on LinkedIn, and then come back next week, Fridays, 2 p.m. Central Standard Time. We'll be here. We'll be here.
That's fine.
Marsha said that's why I did this so rich.
Yep.
Well, okay. That's just part of it. Yeah, yeah. But again, thank you all for joining us, and we'll see you next week.
See ya.